Good morning, everyone. Sadly, overnight, 2 Canberrans have passed away. Both women were in their 80s. One was a resident of the Calvary Hayden Aged Care Facility, receiving end-of-life care. She was fully vaccinated. Another woman was admitted to Canberra Hospital on Friday night, where she received palliative care for COVID-19 and other health issues. So on behalf of the ACT community, we send our condolences and our love to the family and friends of these 2 women at this very difficult time. Overnight, we recorded 28 cases, 14 of them linked, and the balance, the other 14, still under investigation. We can confirm 8 of the 28 were in quarantine during their entire infectious period, but at least 16 were infectious in the community. We have 16 people currently hospitalised across the ACT, 5 in intensive care and 1 requiring ventilation. There were 2,700 tests conducted yesterday, so around our weekend average. On the vaccination front, the ACT's first dose vaccination rate continues to climb at a very impressive rate, yesterday reaching 93.4% of the eligible 12+ population. This very high level of first dose vaccination, when those people have the opportunity to have their second dose later this month, will give our community a very strong level of protection. Our fully vaccinated coverage is currently 64.6% of the eligible population. What we're seeing is incredibly strong nation-leading levels of vaccination coverage amongst over 40s, but it's younger Canberrans who have just not yet had the opportunity to access vaccination, where we still don't have the required level of second dose protection. Our under 40s are less than 60% fully vaccinated. But that number will change as each day goes by. I'd advise those who have yet to make a booking that there are vaccination appointments available today at the AIS Mass Vaccination Clinic. So please, if you haven't come forward to get vaccinated, you can do so today. Put your name against one of those vaccination slots. It's really important that we continue to see our vaccination rates get as close as possible to 100%. For every 1,000 people we vaccinate, we can expect 100 fewer hospitalisations based on around 10% of all cases needing hospital treatment. That's what we've seen through our outbreak so far. Our higher level of vaccination has meant it's been about 10% of cases in the ACT. New South Wales and Victoria have experienced more like 13% of all of their cases. So vaccination works to keep you out of hospital if you contract the virus. So in summary, for those who've joined late this morning, 28 new cases overnight, so a further reduction on yesterday's reduction. 14 of them linked, 8 in quarantine during their entire infectious period, 16 infectious in the community at least, 16 in hospital overnight, 5 in intensive care, and sadly 2 people have passed away overnight. I'll now hand to Dr. Coleman to provide an update on the overnight cases, and then we'll both be available for questions. Thank you.
Good morning, everyone, again, and thank you very much, Chief Minister. So before I begin today, I'd also like to echo the Chief Minister's comments and send my condolences to the family, friends and loved ones of the 2 women who have passed away overnight. And we have 28 new COVID-19 cases that have been notified since our last update. The total for this outbreak is now at 1,005, with the total number of recovered cases 640 and 362 active cases. So just to confirm some of the key details that Chief has also spoken to, of the new cases, 28 today, 14 can be linked to ongoing cases or clusters, with 14 still being investigated, and of the 14, 11 are household contacts. Of the 28, 8 were in quarantine during their whole infectious period, and of the remaining 20, 16 did spend some time in the community for at least part of their infectious period, while 4 remain under further investigation. To 8 p.m. last night, we had 16 people in our hospitals. Our youngest is in their 20s and the oldest in their 80s. 10 are unvaccinated, 4 are partially vaccinated with 1 dose, and 2 are unknown. 5 people are in ICU with an age range from 20s to 60s, and 1 person requiring ventilation. So my shout out today actually goes to our site liaison team within the Health Emergency Control Centre. This team have worked tirelessly throughout the whole outbreak. They work directly with businesses and venues that are identified as exposure locations. So if you've been identified as an exposure location out there, you'll probably have talked to some of this team. As you can imagine, this small team have certainly faced some challenges. We've had almost 1,800 locations over the last 53 days of lockdown. A lot of work needs to go into discussing and analysing and examining the exposure locations before they get up onto our website. And this team are the central point for all of that information and discussions. They engage with the sites, with our doctors, with our data teams, our communications officers, all our directorate liaison officers, and many, many more. And they do always do it with a smile. So I do want to say thank you very much for all your work in getting this information out to the community. Thank you, and I'll hand it back to Chief.
Thank you, Dr. Coleman. Happy to take questions.
Chief Minister, you've been quite strong in recent weeks saying that you didn't want to have to stand up there and make glib announcements about deaths. I'm not suggesting that you've been glib in any of the announcements you've made, but how are you feeling at this point, having had to have announced several deaths?
Well, look, very sad. This community has responded exceptionally well to the call to get vaccinated. And that's the best defence that we have now against the virus. Clearly, we will continue to deploy the public health, social measures and test, trace, isolate and quarantine measures, but as the days and weeks roll by, our best mechanism of defence now is vaccination. And as you've just heard from Dr. Coleman, people who are finding themselves in hospital are predominantly unvaccinated or have only had 1 dose. So it is a reminder that having a first dose doesn't give you as high a level of protection as being fully vaccinated, but having a first dose certainly helps and can reduce the severity of illness. So I'm really pleased to see that in the data yesterday, still 60% of the vaccinations issued through our mass vaccination clinics were still first doses. So that gives me encouragement that we're going to go well beyond 95% vaccination coverage. And the higher our vaccination coverage, the safer our community is, the fewer people will end up in hospital and fewer people in intensive care and a fewer number of deaths, which really is what we are striving for here in our public health response.
Will daily deaths just be a part of COVID normal now?
Well, maybe not every day, and we'll work incredibly hard to minimise the number of people who get severely ill with this disease. Part of that is in the hands of individuals, though, in coming forward to get vaccinated. The evidence is very, very clear in Canberra, in Sydney, in Melbourne, across Australia, around the world, that if you are vaccinated, your chances of surviving severe disease are much, much stronger. So, look, we've appealed to people's community spirit, and that's been evident in spades in Canberra in coming forward to get vaccinated. But for some people, it's not about the community. Sometimes you just have to appeal to their own self-interest. And so for these last few percent of the population, the appeal is think about your own health, even if you don't think about the broader communities.
You expressed concern that we might see a few grand final parties over the weekend. What's the reporting on complacency looking like, or compliance rather?
Well, look, police didn't advise at this morning's update of major concerns about NRL grand final parties. Clearly there'll be some very happy Penrith supporters today and some South supporters who'll be commiserating. Rugby league was clearly the winner last night.
On Friday, the Prime Minister described State and Territory's call for 50-50 hospital funding as shakedown politics because Anastasia Palaszczuk had linked that issue to the Queensland border reopening. And what did you make of those comments? And what is the status of that request at the moment? Has the Commonwealth even conceded the principle that 50-50 funding should continue during the pandemic?
Well, look, I didn't think they were particularly helpful comments, given that we are still engaged, deeply with the Commonwealth on the multifaceted pandemic response. And in light of the discussion in National Cabinet on Friday around the different elements of what all state and territory health ministers put forward in that letter to Minister Hunt. So, this is Liberal New South Wales, South Australia, Tasmania, Liberal state governments and Labor state governments put forward a series of issues that will need to be addressed. It's not a party political thing. It's not Labor versus Liberal. It is simply about what we will need to do across all levels of government for our health system to manage what is, I hope, a once-in-a-lifetime experience. Now, part of that discussion is around what's referred to as bed block within the health system, where patients remain in hospital when they really should be in an aged care placement or an NDIS placement. These are areas that the Commonwealth has responsibility and regulatory responsibility. And Dr. Brendan Murphy in the National Cabinet meeting was quite clear that he would be working on this specific issue. And I was really pleased to hear that, because it's not just an issue for the ACT, it's an issue for every state and territory. The Commonwealth and the states and territories have worked well together on mental health support packages. That's one of the other asks within the letter to the Commonwealth. We've done that on the basis of a 50-50 funding arrangement. That's been the case up until this point, so I would hope that that would continue over the coming 12 months. Then there are the questions of the 50-50 partnership that currently exists in relation to COVID costs, which is a sound principle. It's not as if the states and territories are asking the Commonwealth to pay for everything. It's a 50-50 funding arrangement. I think the one thing that definitely does need to be talked about relates to the cap on the increase in activity-based funding in the health system that was set pre-pandemic at about 6.5% each year. Now, clearly a pandemic is going to lead to an increase in activity across the hospital system of more than 6.5%. So I don't think the states and territories are asking for a permanent increase in that activity cap, but I think it is reasonable in the context of a once-in-a-lifetime global pandemic that we are able to at least have a conversation about sharing the costs of this once-in-a-generation event. I would not consider that shakedown politics.
And is that discussion in National Cabinet still ongoing, or has the Commonwealth been as firm behind closed doors as they were publicly?
Well, look, the Prime Minister didn't really address the three other points in relation to aged care, NDIS, mental health, those sorts of areas, and reasserted that the Commonwealth had made its position on 50-50 funding quite clear. So given that that's all we're asking for is a 50-50 share of the increased activity that's is clearly going to occur over this fiscal year in particular, I don't consider the door closed on that question. Obviously, I'm not here speaking for the Prime Minister, but every single state and territory, Liberal or Labor, has put this issue forward. But in terms of emissaries to the Prime Minister, I think that the New South Wales Premier-elect, if it is to be Mr Perrottet, will certainly need to lead the engagement with the Commonwealth on this specific issue. And New South Wales, as the biggest state, would clearly have the most to gain from a successful negotiation here with the Commonwealth.
Chief, on New South Wales, a bit of a, spanner in the works on their COVID-19 response with the resignation of the Premier, Deputy Premier and a Senior Minister. Does this, throw up any extra hurdles for the ACT's response?
Well, that's been an extraordinary 72 hours in New South Wales politics. I guess it will remain to be seen how quickly the new New South Wales government leadership can hit the ground running. I mean, many of them have been involved in their crisis cabinet deliberations, so I hope it's a short-term hiccup rather than a long or medium-term setback to what we will all need to do. New South Wales and what they do obviously has very significant implications for the ACT. But look, I've known Don Perrottet for quite a while now, as he has been New South Wales Treasurer. I've been in hundreds of meetings with him over the last 3 or 4 years. And if Matt Keane is to be the new Treasurer, as has been extensively reported, I've known Matt for a long time as well. So I hope to be able to have some productive engagement with them once they've got their feet under the desk.
More than a third of teachers surveyed by the Education Directorate feel that schools may not be as safe as they could be. Are you confident enough has been done to ensure that schools in the ACT are safe when teachers return and that those concerns of teachers have been addressed?
Look, I'm confident that there's a really strong and robust COVID-safe framework that's been prepared, but because teachers have been in their stand-down period during the school holidays, I am conscious that not every teacher would be aware of everything that has been done at a territory level through the Education Directorate, the Health Directorate, and then how that sort of drills down to each individual school setting. So it will be important when school resumes tomorrow that we're able to engage with the teaching profession on these matters. So I take the survey results seriously. We've obviously been surveying teachers in relation to their vaccination status, and so we'll be looking at those issues together with the school safety context, both across the entire system and then at an individual school level. I mean, we have schools in the ACT that range in age from 1 year to 100 years, and so the individual responses will necessarily
strategies in place. So the very near future will hold a more nuanced consideration of risk of transmission to healthcare workers based on the actual strategies that are in place to protect from transmission.
Dr Coleman, lots of people out and about over the long weekend as the weather improves. Are you concerned at all that Canberrans are growing complacent?
So I haven't seen it myself. Unfortunately, I've been here for the whole of the long weekend. But if you're saying that there are, that's great. I think, as we've talked about, outside is a lot safer than inside. It's a greater reduced risk of transmission. And I know that Ministers for Health spoke yesterday about the biggest thing to be careful about is how you interact and the size of those interactions. Canberrans have traditionally and for the longest time respected that and come along for our journey. So let's hope that that plays out over the next week or two in the cases that we see.
Doctor, how is that cluster at the Calvary Hayden Aged Care Facility tracking? Is it likely we could see more deaths coming out of that facility?
So I understand there are no further cases within the last 24-hour period, but as we've seen in other aged care facilities, often residents of aged care facilities do tend to be older and often have multiple comorbidities or multiple other conditions. So I think people should anticipate that this is where we are likely to see, unfortunately, deaths moving forward, if and when they occur.
Dr. Coleman, have there been any more cases identified at the AMC after that staff member tested positive?
As far as I'm aware, we've had no further cases from there. Thank you.
Come around here. Hold that.
I think you've been questioned.